Apixaban side effects. What you should know before taking this medication. Hi, everyone. In this video, I'm going to be talking about the potentially serious side effects of the medication, Apixaban. This medication is used to reduce the risk of stroke and blood clots in people with atrial fibrillation, but it can also have some serious side effects. Before taking this medication, it's important to be aware of these side effects and talk to your doctor about any concerns you may have. So let's get started. Apixaban is a medication that is used to prevent stroke and blood clots in people with atrial fibrillation. While Apixaban can be a life-saving medication, it is important to understand the potential side effects before taking it. In this video, we will discuss the side effects of Apixaban, how to recognize them, and when to seek medical help. We'll also provide you with the information you need to make an informed decision about taking this medication. What are the most common side effects of Apixaban? Apixaban is a medication that is used to reduce the risk of stroke and blood clots in people with atrial fibrillation, AFib. It is also used to treat and prevent deep vein thrombosis and pulmonary embolism in people who have been treated with hip or knee replacement surgery. The most common side effects of Apixaban include bleeding, headache, dizziness, nausea, and indigestion. Other less common side effects may include diarrhea, vomiting, fatigue, constipation, muscle pain, back pain, rash, stomach pain, and difficulty sleeping. Some patients may also experience swelling of their hands or feet, increased heart rate or palpitations, shortness of breath, chest pain, or sore throat. If you experience any of these side effects, it is important to contact your doctor right away. What should I avoid when taking Apixaban? When taking Apixaban, you should avoid activities that increase the risk of bleeding, such as contact sports. You should also avoid drinking alcohol while taking Apixaban, as it may increase the risk of bleeding. Additionally, avoid taking any non-prescription medications, herbal supplements, or vitamins without consulting your doctor first. Apixaban can interact with certain medications and supplements, increasing the risk of bleeding. Finally, do not take Apixaban if you are pregnant or breastfeeding, as it may harm the unborn or nursing baby. Does Apixaban make you tired? Apixaban is a blood thinner medication that helps to prevent blood clots from forming. It is not known to make people feel tired, though some people may experience fatigue or tiredness as a side effect. In general, Apixaban does not cause drowsiness or sedation, but it can cause dizziness, which can lead to feelings of tiredness. If you experience fatigue or tiredness while taking Apixaban, talk to your doctor to see if there are any other medications or treatments that may help. Additionally, make sure to get plenty of rest and exercise regularly, as this can help to reduce feelings of tiredness. What does Apixaban do to the heart? Apixaban is an anticoagulant medication that works to prevent the formation of blood clots in the heart. It does this by inhibiting certain clotting factors and reducing the production of thrombin, a substance that helps blood clots form. Apixaban also blocks factor XA, an enzyme that helps convert fibrinogen into fibrin, which is necessary for the formation of a clot. By blocking these factors, Apixaban helps to keep the heart healthy and reduce the risk of stroke and other serious complications. Apixaban may also be used to treat deep vein thrombosis, DVT, and pulmonary embolism, PE. How long is it safe to take Apixaban? Apixaban is an anticoagulant medication that is prescribed to prevent blood clots and help reduce the risk of stroke. While the length of time it is safe to take Apixaban will be determined by your doctor based on your individual health needs, most people take it for at least 6 months. In some cases, patients may need to take Apixaban for up to 12 months or more. It is important to speak with your doctor about the benefits and risks of taking Apixaban for an extended period of time. Can you be on Apixaban for life? Yes, it is possible to be on Apixaban for life depending on the medical condition being treated. Apixaban is an anticoagulant medication used to reduce the risk of stroke and blood clots in individuals with certain medical conditions such as atrial fibrillation, deep vein thrombosis, and pulmonary embolism. The duration of treatment with Apixaban may vary from patient to patient and is dependent on the particular medical condition being treated. In some cases, patients may need to take Apixaban long-term or even for life. It is important to follow your healthcare provider's instructions and to speak to your provider about any concerns you may have regarding taking Apixaban for an extended period of time. Can Apixaban cause weight gain? Weight gain is not a known side effect of Apixaban, and it is not typically listed as an adverse reaction to the medication. However, some people may experience weight gain as an indirect result of taking Apixaban. For example, Apixaban can cause an increase in appetite, which could lead to weight gain. It is also possible that Apixaban could interact with other medications or conditions that may cause weight gain. If you have experienced any weight gain while taking Apixaban, it is important to talk to your doctor about it so that they can evaluate any potential causes and recommend appropriate treatment. Does Apixaban cause dementia? There is currently no evidence that Apixaban causes dementia. While Apixaban is sometimes used to treat and prevent blood clots in the brain, which can lead to stroke and other problems associated with dementia, Apixaban itself has not been linked to an increased risk of developing dementia. In fact, some studies have actually found that Apixaban may be beneficial in reducing the risk of stroke, which can help reduce the risk of developing dementia. Additionally, Apixaban is not known to interact with any medications or supplements known to cause cognitive decline or dementia. Therefore, it is unlikely that Apixaban is related to the development of dementia. Apixaban side effects in elderly? Apixaban is an anticoagulant, or blood thinner, that is used to reduce the risk of stroke and blood clots in individuals with atrial fibrillation or other conditions. It is generally well tolerated and has few side effects. However, elderly individuals may be more likely to experience adverse reactions. The most common side effects of Apixaban include bleeding, bruising, and low red blood cell count, anemia. Other potential side effects in elderly individuals may include dizziness, drowsiness, confusion, rash, headache, abdominal pain, nausea, increased risk of infection, and changes in vision. In addition, Apixaban may interact with other medications and cause more serious side effects. It is important that elderly patients taking Apixaban discuss any drug interactions and potential side effects with their doctor. Foods to avoid with Apixaban? It is important to note that Apixaban is a type of anticoagulant medication, also known as a blood thinner. As a result, it can make it harder for the blood to clot and increase the risk of bleeding. For this reason, there are certain foods you should avoid while taking Apixaban. These include foods high in vitamin K, such as green leafy vegetables, such as kale, spinach, and collard greens, Brussels sprouts, broccoli, and cauliflower. You should also avoid consuming large amounts of alcohol, as this can increase your risk of bleeding. Additionally, you should avoid foods that are high in salicylates, such as berries, grapes, oranges, tomatoes, and apples, and foods or drinks containing caffeine. Lastly, you should avoid eating large meals that are high in fat, as this can cause the medication to be less effective. Apixaban dose in elderly? Apixaban is a medication used to reduce the risk of stroke and blood clots in people who have atrial fibrillation, AFib, not caused by a heart valve problem. The recommended dosage for elderly patients, aged 75 years or older, is 2.5 mg taken orally twice daily, with or without food. For those aged 80 years and older, the recommended dose is 2.5 mg taken orally once daily. It is important to note that this may vary depending on other underlying medical conditions and the patient's response to the medication. Patients should always follow the instructions provided by their healthcare provider. Apixaban side effects NHS? Apixaban is a medication used to prevent and treat blood clots in people with certain medical conditions. It is most commonly prescribed for the prevention of stroke and other serious complications in people with atrial fibrillation, AF. Although Apixaban is generally safe and effective, it may cause side effects in some patients. The most common side effects reported with Apixaban include dizziness, headache, nausea, fatigue, and low blood pressure. Other more serious side effects can also occur, including bleeding, allergic reactions, and liver problems. The NHS advises that if you experience any of these side effects while taking Apixaban, you should contact your doctor or pharmacist immediately. You should also seek medical help if you experience any unusual or severe symptoms while taking this medication. Apixaban and alcohol? The use of Apixaban and alcohol should be approached with caution. While the exact interactions between Apixaban and alcohol are not known, there is a potential for increased risk of bleeding when consuming alcohol while taking Apixaban. Therefore, it is important to speak with your doctor before combining Apixaban and alcohol, as your doctor will be able to provide the best advice for your particular situation. Heavy alcohol consumption should be avoided when taking Apixaban, as drinking large amounts of alcohol can increase the risk of bleeding in individuals taking Apixaban. If you do choose to drink alcohol when taking Apixaban, it is important to keep track of how much alcohol you are consuming and to be aware of any changes in your health that could be related to alcohol consumption. Additionally, it is also important to avoid consuming alcohol while taking other medications that could increase the risk of bleeding. Side effects of Eliquis 5 mg? Eliquis 5 mg is a medication used to reduce the risk of stroke and blood clots in people with atrial fibrillation, irregular heartbeat, not caused by heart valve disease. Common side effects of Eliquis include bleeding, mild or severe, such as unusual bleeding from the gums, nosebleeds that happen often, unusual bruising, red or pink urine, or coughing up blood or vomit that looks like coffee grounds. Other side effects may include signs of anemia, low red blood cells, which may include feeling very tired, pale skin, shortness of breath, cold hands and feet, headache, chest pain, dizziness, and fast or irregular heartbeat. If you experience any of these side effects, contact your healthcare provider immediately. You should also tell your doctor if you have any serious side effects, including signs of liver problems, nausea, vomiting, tiredness, loss of appetite, yellowing of the skin or eyes, dark urine, or light-colored stools, low blood sugar, dizziness, confusion, sweating, tremors, fast heart rate, trouble concentrating, or hunger, or signs of infection, fever, chills, sore throat, cough, or other symptoms. Apixaban contraindications? Apixaban is contraindicated in patients with active pathological bleeding, known hypersensitivity to apixaban or any of its excipients, moderate or severe hepatic impairment, and in patients with prosthetic heart valves. Apixaban should also not be used in patients who have had a recent stroke or transient ischemic attack, or those with atrial fibrillation and a history of intracranial hemorrhage. In addition, apixaban is contraindicated in patients with a mechanical heart valve or with severe renal impairment, CRCL 15 ml per minute, in the absence of dialysis. In conclusion, apixaban is a medication that is used to prevent stroke and blood clots in people with atrial fibrillation. While it can be a life-saving medication, it is important to understand the potential side effects before taking it. The most common side effects include bleeding, headache, dizziness, nausea, and indigestion. It is important to avoid activities that increase the risk of bleeding, such as contact sports, and to avoid drinking alcohol and taking non-prescription medications, herbal supplements, or vitamins without consulting your doctor first. If you experience any side effects, it is important to contact your doctor right away. Remember to take your medication as directed, and be sure to talk to your doctor about any questions or concerns you may have. Thank you for watching.